My name is October Boyles. I am the training team manager with ICANotes, and my background is I am a registered nurse. I have been a registered nurse for about 16 years now, and I've been able to work in psych and mental health for 13 of those. So I ran a large outpatient clinic. It consisted of 11 psychiatrists and 6 nurse practitioners, and so I had to become very fluent in meaningful use. And so now we have kind of switched gears a little bit. So we're going to talk about MIPS and what you need to know about MIPS and some of the most important things, and we're going to go over that today. To first get started, let's talk a little bit about what MIPS is all about. And this is basically the Medicare Access and CHIP Reauthorization Act of 2015. This is an act that was passed by Congress in 2015 that moves Medicare from a fee-for-performance model to a value-based payment program in 2017. And there was a couple reasons this was done. This was done to improve outcomes, to link payments to performance, to reduce costs, to reduce fraud, to reduce waste, and most importantly, abuse. So that is where this all came about and why we're getting started talking about this. We're going to go through and I'm going to explain some of the basics, because sometimes when the government puts out things, it's not really clear. And so that's, hopefully we can give you a little bit of clarity on this subject today. So next we're going to go on to the Quality Payment Program. So the results of the Medicare Access and CHIP Reauthorization Act of 2015 is the Quality Payment Program, which is known as QPP, and it has 2 tracks. So if you decide to participate in traditional Medicare, you may earn a performance-based payment adjustment through MIPS. There's an alternate or advanced alternative payment model, the APM, and the APM is basically where a group of providers would gather around the patient, they would share information, and then profit or lose money on the budget they were provided with the patient. So the advanced APM, it's a shared risk of loss. So now most behavioral health clinicians are going to be reporting on MIPS, that merit-based incentive payment system, if they meet the Medicare threshold. And I'm going to be focusing mainly today talking about the merit-based incentive payment system, because that's what most of you are going to be dealing with. So we're going to go ahead and talk a little bit about the requirements for that. So with MIPS Medicare threshold requirements, clinicians are required to report in 2017 and 2018, and it's, when I say clinicians or providers, it's physicians like psychiatrists, physician assistants, nurse practitioners, clinical nurse specialists, all of you folks who meet the above Medicare threshold. Now reporting is actually going to be optional for hospital-based clinicians in 2017. That's anticipated to change. But you must report if you have more than $3,000 annually or per year for Medicare, and provide for more than 100 Medicare patients per year. So if both of these apply to you, you need to participate. If neither of these apply to you, you're exempt from MIPS for today. But those people below the threshold, you don't have to participate, but you can, and CMS will actually give you a score. It doesn't help you or hurt you, though, to participate on that. So now the need to report is going to be in 2017 at least 90 days or more if possible. And by doing that, you're going to avoid a 4% reduction of payments in 2017. And what they call this is a payment adjustment, but in reality it means a penalty. So again, just restating, MIPS means to you that you need to report on at least a test or some type of MIPS components in 2014 to avoid that 4% penalty. And then to obtain the highest reimbursement, you should report on at least 90 days and more if possible in 2017. So now we're going to get into what MIPS really consists of. There are 4 categories. They're listed on the slide, and clinicians will receive a score for each category except cost. And you'll get a total score for all the categories. Again, cost is not put in this year. However, you will see that come up next year, and we'll go over costs a little bit. In 2017, to avoid that Medicare payment penalty of 4% in 2019, you can do a very minimal test report. And so, but again, the four categories are the quality, advancing care information, improvement activity, and cost. Your biggest bang for your buck is going to be your quality. Your quality is formally your PQRS, and that's 60% of your total score. It's the highest percentage they have. The advancing care information is going to be 25% of your score, and improvement activities is 15% of that score. Again, here's the categories just laid out so you can see them. Quality replaces PQRS. Improvement activities is brand new for us. And then advancing care, this replaces the Medicare EHR incentive program, which we knew is meaningful use. And cost replaces the value-based modifier. So on quality reporting, since quality is the highest, you must report on 6 quality measures. So you can do this several different ways. You can do this via Medicare claims or qualified registry. Okay. So select measures, there are only select measures that are reported via claims if you're reporting via the claims way. I will tell you though, we've been through the website, and for a qualified registry, you get the highest percentage. So I have listed in this PowerPoint, in this slide, the Medicare Quality Incentives Patient Assessment Qualified Registries, and this PowerPoint is going to be available on our website and sent to all participants in today's session. Now, there is a cost associated with the qualified registry, but it's minimal compared to the percentage that you would lose if you choose not to report. So again, the link above is going to be to all the qualified registries that are listed. And if you're going to use a registry, and this is the optimal way to go, is using one, but please utilize this link or contact ICANotes so we can give you the information regarding the registry, because you don't want to use a registry that's not qualified. So, all right. And again, there is a fee associated with the registry, but it's minimal. Now here are some of the quality codes for the behavioral health measures. And as you notice, in this slide, some of these health measures are everyday things you do in your practice, and you can just document things such as medications, you're doing the med rec, if you're discharging someone, taking weights, vital signs, pain assessments, and all of these measures are clinically weighted with the scores. So some of them are higher than others, and you can decide which ones work best for you by going to the website, or you can have a one-on-one training conducted by ICANotes to kind of help you make the decision on which is best for you. Because with ICANotes, we try to get you into the highest weighted scores. Now we talked about quality, again, that was 60%. So next we're going to move on to advancing care information. So the advancing care information, again, formerly Medicare, meaningful use, is 25% of your total score. And it has 2 scores. And we're going to go over that, a base score and a performance score. And when they're added together, that gives you 100 total points for the advancing care information category. And that score is based on things like patient electronic access, coordination of care through patient engagement, and health information objectives. So there's also bonus points that can be awarded as well. And so that's one of the things we can go over as well. So not only do you have the ability to earn your total score that you need, but you can get bonus points, and bonus points gives you extra incentives, which means extra money. So now I've got everyone interested, huh? So the next thing we're going to move on is to the advancing care information, and these are your base scores. So if you notice on your base scores, you have things like e-prescribing, electronic prescribing. That's actually a requirement. You have, your first one is your protect patient health information. This is actually, it's a security risk analysis that you do yourself and that you just document, and this is very easy to do to meet this score. The third is the patient electronic access. And that is also, as you can see, it shows you if it's required or not required for a base score. It is required. And with the patient electronic access, you're basically providing patients access to view online their information, to download it, or to transmit it. So at least one patient that's seen by the provider clinician, they will view their record, download the record, or you can transmit it to a third party. And so again, with this is actually, I mean, it sounds like it's a difficult score, but it's not. If you can just get one patient to go into the patient portal to send you an email, you can achieve this score. So now to do that, you have to have the patient portal, and you can ask ICANotes to enable the patient portal functionality on your account. It's very easy to do this, and it doesn't take a lot of extra steps for yourself or your front desk staff. To enable a portal, it's just a click of a button and the demographics. So you need an email address and literally click the portal button, and that's all. So it's not a lot of extra work that goes into this, but you can get extra points. So the next is the patient. We talked about patient electronic access, patient-specific education. That can also be completed in ICANotes, and we'll go over that kind of towards the end, what you can do as far as educating your patients and documenting that education and having that available in your records. And the last is secure messaging. Secure messaging, No2, we have a functionality called No2, and that's a way to send patient information securely to other providers and to direct care contacts. And you can use that secure electronic messaging to communicate, again, with your patients on relevant health information, and that can also be done by the patient portal. So, but No2 is also an option that we have as well. All right, I'm going to move on from this area, and then I'm going to go next into the 2007 ACI transition objectives. And some of these are health information exchange, which we talked a little bit about earlier, medication reconciliation. This is something that can be done, and also public health reporting. Now, I know in mental health, a lot of folks are not doing the immunizations and things like that. However, you can even report null and get credit. So just know that you're able to do that. So, but that's actually not required. If you see public health reporting is not required, but it will get you some bonus points there. But the health information exchange is required. So I just want you to kind of take note for that. There are also going to be reports in ICANotes that you can run to collect data for advanced care information. And that's going to be found in the reports section of ICANotes. That section is currently called Meaningful Use, but this will be changed to MIPS. And you'll see that there's a reporting tab on the left-hand side in the upper corner of ICANotes. It has your billing and productivity reports and your billing reminder sheets. And down at the very bottom, you're going to see the MIPS reporting. That you will start to see that in maybe a week or two. We'll have that up for you. And the next, or the last category, third to last, but the one that's the most important because cost doesn't give me any points, is improvement. And that's 15% of your final score in this transition year. Again, this is a new performance category for 2017, and clinicians are rewarded for care focused on care coordination, beneficiary engagement, and patient safety. So to achieve a full credit, a clinician must report on 4 medium-weighted or 2 high-weighted activities for a minimum of 90 days. We keep stressing that 90 days. That's the least amount that you can report. So now for small practices with 15 or fewer providers, especially if you're a rural practice or your practice is located in a geographical health professional shortage area, you only have to have 1 high-weighted and 2 medium-weighted activities. So now it's important that you're going to be keeping track of your improvement activities that you perform. So you are actually going to be the one that's going to keep track of these. So improvement activities, let's just go over some of them. And some of them we have in our program. Like we have depression screenings within our program. We have the electronic health record enhancements for the behavioral health data capture. We have engagement where you can say that you, or document that you followed up with your new Medicaid and Medicare patients. We have tobacco use that's listed, so we have a nice tobacco scale in ICANotes. We also have alcohol scales, so as far as unhealthy alcohol use and using an appropriate screening tool that we have in our ICANotes system for that. And then there's just documentation of engagements of patients' families and caregivers and developing a plan of care. So you're able to do this. And the last one that we're going to go over again is cost. And we've talked about, this is something that you're going to need to learn more about in the upcoming years, but right now there's no scoring or reporting required right now for 2017. So now let's talk about how you can earn an incentive via MIPS. Again, we keep stressing 90 days of reporting, but you can start that at any time. You can, obviously January 1st was a long time ago, but you have to October 2nd, and you can earn a small positive payment adjustment. If you reported on the entire year of 2017, you're going to probably get even a larger adjustment, but you just need 90 days. And CMS has said that MIPS payment adjustment is based on the data submitted, and of course the best way to get that is to participate for a full year, but we're kind of on the back end of that. So, but if you report for 90 days, you could still earn the max adjustment based on your score. Now, positive adjustments are based on the performance data submitted, not the amount of information or the length of time that you submitted. It's really the performance of the data you submit. So, all right. Now, you get to pick your pace with MIPS. That's one of the nice things. You cannot participate at all, but then you're going to get, again, they call it a negative 4% payment adjustment, but you're going to get a penalty. Now, you can submit something, like the 90 days, and you can avoid that. You can submit for a partial year of the 90 days, and you can get a positive payment. You might even earn the max adjustment. And if you submitted for the full year, if you've already been doing this, then you're more than likely going to get a positive payment adjustment. So, so basically you can do nothing and get a penalty. If you submit something, you don't get a penalty. And if you submit for 90 days or the 4 years, you could get the 4%. And one of the questions you guys are probably asking yourself now is, how are they getting the money? Basically, the money is in a bucket, and the people that don't participate don't get the money, and if you participate, you get their money. So that's the easiest way to explain where this is coming from. Let's talk about the submission of data that you're actually going to need to submit. Again, you have 2017, you get your performance, you submit your data, they give you feedback, and then you get that adjustment on January 1st. Of 2019. Now, CMS will provide feedback after you submit your data, and you're going to submit that in the form of a QR report, and this will come around kind of midsummer for you in 2018. Now, if you don't agree with your score, you have an advanced awareness of that prior to January 1st, 2019. So that gives you time to resubmit data and kind of go back and forth with them to see if they'll increase the score. This is all new, so we don't know if they will, but that does give you time to kind of reset data if you're unhappy with the score that you received. So the next part is, how do you get started in ICANotes? Well, there's a couple different ways. If it's not already enabled, you can ask the ICANotes staff to enable like the MU measures, the patient portal, direct messaging from the portal, and to always generate a CCDA. And those things you can document. There's also, without having to talk to the staff, you can go into your chart room, you can open up settings and directories, and you can select options. And the two boxes you would want to check are your patient-specific education and clinical decision support rules. So you're able to individually do that yourself, so you can start collecting data on giving patients in education and also clinical support decision rules. So those are some ways that you can get started. Now next, how can ICANotes help you? Because we understand that MIPS it's new and it's confusing and it can be difficult, and a lot of you don't have time to sit down and go through the website and collect all the data and things like that. So what ICANotes is offering is we're offering MIPS training at a cost of $250 per hour, or you can have a full consultation, which is unlimited training for the year for $1,500. Now, if you want to ask an ICANotes related question, you can send an email to that email address I have listed. And I also have some additional resources below. So we have the CMS Help Desk for a Quality Payment Program. The APA has webinars, and there's the QPP on the cms.gov, and that website is actually updated regularly, which is nice. And we have a fact sheet as well that you can see. But those are some things, the ways that ICANotes can help you as far as getting MIPS under control, making sure you get your data in. We can also, again, give you suggestions on things that you can track your data a little bit more easily with, and also figure out what your workflows are for your practice, and within your workflows, without having to change a lot or do a lot of extra work, make sure that you're capturing the right data so you can get that high performance score. We are not actually going to be taking any questions during this training. We want you to email your questions to the macro@ICANotes.com. My name is October, again, at ICANotes.com, and then Betty is, she is our Chief Compliance Officer, so Betty at ICANotes.com. We will be happy to take your questions or any questions that you have regarding this. I thank you so much for joining our session today. And again, if you have questions, please don't hesitate to contact us, and we wish you the best of luck. Have a great day. Bye-bye.